I think the most important thing that we want to say is that neurologists provide palliative care. They do need to be aware of the needs of patients and families. And one way to help that, there are scales that could be used on a regular basis so that patients, perhaps even in the waiting room for outpatient clinic, can quickly fill in a short questionnaire, which will raise issues. And then when they come into a clinic, someone can be aware that there are particular issues that are worrying that person. If they can deal with that, all to the good. Maybe other members of their wider team. It may be then thinking, I think we need to use our specialist palliative care colleagues. And the most important part of that is explaining that they're there as another team to help, rather than we can't do anything more. When I first started in palliative care at the hospice I recently retired from, which was back in the 80s, I used to get a neurologist refer, I'm sorry, I've got to refer this patient to you now. When I retired, I asked patients, what have you heard about me? And they said, well, the neurologist said she knows this person who is experienced in ALS, has a team who can help you. I think it will be a help. They do work at the hospice, but they will be able to help you. So, and that was a much more positive way, rather than seeing palliative care at the end of life only. The other important thing, I think, is always to remember the importance of multidisciplinary team working. And in ALS, there have now been 2 studies that have shown that people who had a multidisciplinary approach, often including a palliative care person or palliative care expertise, have had a better quality of life and even lived longer than the people who have not only been going to a regular clinic on a ad hoc basis. So I think the multidisciplinary team, we don't quite know what is the secret of that, but I feel it's the fact that people share information. So a speech therapist may come back to a neurologist and say, I'm worried about this person. I saw them last week, I'm worried. What should we do? The physiotherapist has seen someone at home and felt they were more breathless, comes back and says, I think we need to do a respiratory assessment. So I think it's that real working together, which can happen within a neurology team very easily. And I think over the coming years, I hope that there will be more multidisciplinary approach, regular assessments of patients with neurological disease, and including within that palliative care expertise or very close collaboration with specialist palliative care teams.